Yeah, welcome to our Turing-Roche Knowledge Share series. The aim of these monthly events are to bring together members of the Turing-Roche networks and the wider scientific community to hear different perspectives on data science topics and build new connections. For those of you who have joined us before, this would normally be the point where I would share a couple of slides on the background of the partnership, but I don't need to do that today, as we're doing a slightly different format. And we have members of the partnership team joining me who will be giving background on the partnership and our plans for 2023 and beyond. And I will now hand over to our partnership team. I think Alvaro is going to share his screen, and I think Ben's going to kick us off.
Great, thank you, Vicky. Thanks, Alvaro. So hello, everyone. Thanks for joining us today. My name's Ben MacArthur. I'm the Deputy Programme Director for Health and Medical Sciences at the Turing, and I'm one of the leads for the Turing-Roche partnership that we're going to tell you about today. So can we go to the next slide, Alvaro? So really, we kicked off in June 2021. So we've been going now on this partnership for around 18 months. And so what we wanted to tell you about is firstly, what's been happening since then, what we've been doing in the last 18 months, and also where we're going next. And just to tell you about some opportunities for getting involved in that work as well. So should we go to the next slide? So just to give you a very quick overview, obviously it's a partnership between the Alan Turing Institute and Roche. So we have representation from both sides. On the Turing side, on the partnership team is myself and Chris Holmes, and you might know that Chris Holmes is the Programme Director for Health and Medical Sciences at the Turing. And we're of course supported by some great people. We've got Trina Payne, who's our Partnership Development Lead, Alvaro, who's here with us today, and Vicky, who is our great community manager. And then on the Roche side, we've got Ryan, who is the Global Head of Data Science Acceleration at Roche, and Sarah and Chris Harbron, who you'll hear more from later in this presentation, also supported by Michelle and Jay. So these are the core people on the partnership team. We've been working together now for the last 18 months. On all the various different projects that we're going to tell you about today. Can we go to the next slide? So this is really an outline of what we'd like to tell you about today. So obviously the Turing-Roche partnership is a partnership between two organizations, the Alan Turing Institute and Roche. So we're going to tell you a little bit about both of those organizations separately. Then we'll tell you something about the Turing-Roche strategic partnership, a little bit about what we call our North Star, that is our guiding light, where we're going with the partnership. We'll tell you something about, we'll introduce to you actually our senior postdocs. Both of them are on the call today, and both of them will be presenting some of their work to you today. And then we'll tell you about the themes that we are pursuing. So we have three research themes that we're focusing on. So we'll tell you something about those three research themes and the various different projects that are associated with those themes. And then finally, Vicky will give you an update on our community activities. So as you might, many of you will know, I'm sure, the Alan Turing Institute is the UK's National Institute for Data Science and AI. It's really a network of university, industry, charity and government partners. We have reach across the country and across all of the various different data sciences. So from mathematical modeling, statistics, artificial intelligence, machine learning and so forth, with applications really across the board. The Turing Institute is a strategic government investment. So we receive strategic investment to build this network across the country. We're located in London in the British Library, and you can see the photo shows the entrance to the Turing offices. And we're directed by Adrian Smith, who is also the president of the Royal Society. So we have really great reach across the country. Lots and lots and lots of different research activities and innovation activities on the go. And the health program is part of that that initiative. So can we have the next slide? So as you might guess, as a national institute, we have lots and lots of partners, industry partners, charitable partners, government partners, and we work with many different organizations. We have a set of strategic partners, and those are the ones in the banner in gray at the top. So these are organizations with whom we have a very strong relationship, significant programs of strategically important activity. And you can see we have a number of strategic partners. Roche is there on the far right because it's the most recent of our strategic partners. But you can see we have a number of others in lots of different areas of science and innovation. Focusing on the health program specifically, the health program was started in 2018, so we're not too old, more or less 5 years old now. Chris Holmes, as I said, is the director. Chris is a statistician. He's based in Oxford. I'm the deputy director. I started in 2020. And we also have two other academic leads, Alicia Davies, who leads on public health research for us, and Owen Rackham, who leads on the other end of the scale, cell and molecular medicine. And of course, we have a fantastic team of program managers, project managers, and community managers. And you can see some photos there, and you probably recognize some of those faces. So the aim of the Health and Medical Sciences program is really to use data science to accelerate the understanding of human disease and improve human health. So we're interested in supporting the rigorous, robust development and application of AI and data science tools to problems in human health. We do that by building strong, long-term strategic relationships with government, charity, and industry partners, and Roche is one of our major partners in this area. And also by tackling major real-world applications with domain experts, so working closely with biomedical scientists, working closely with clinicians and so forth, which in turn informs methodological and theoretical innovation. So if you're interested in learning more about the Health and Medical Sciences program, you can follow the link on this QR code, and it will take you to our webpage where you can see much more about us, all the different projects that we're working on or have worked on in the past. Next slide, please. So as with the Turing as a whole, the health program works with lots and lots of different partners, industry, charitable and government partners, and other research organizations. Currently, that we're particularly focused on programs of work that are focused on early detection of disease, risk prediction, and we'll tell you a bit more about some of these things in a moment. We've done lots of work on pandemic response and future preparations. We're particularly interested in multiple long-term conditions or multi-morbidities and data science for cell and molecular medicine. And we work closely with lots of other parts of the Turing, particularly the Defense and Security program, the Public Policy program, the Tools, Practices and Systems program, and the AI for Science program. So really, we have lots and lots of activities and interests across the data sciences with applications to various different healthcare problems. Our core agenda really is in robustness and accurate uncertainty quantification and producing reproducible methods for AI in health. Next slide, please. Okay, so I'm passing over now to Chris Harbron, who's going to tell you about Roche.
Great. Okay, thanks a lot, Ben, for that. Yeah, so I'm Chris Harbron. I'm one of the co-leads for the partnership on the Roche side. I was just going to start here by just talking a little bit as an introduction to Roche as a company, and then talk a bit about an overview of the partnership as a whole. So Roche is one of the world's largest healthcare companies. It's been going as a company since 1896. It recently had its 125th anniversary. And yeah, interestingly, it's still a family-owned company, which is something which creates a stability and actually a long view within it. It's very much a company which has got a big investment in R&D and sort of is probably one of the highest investors in R&D, both sort of an absolute and percentage basis, in this particular sector. Go to the next slide, please. Yeah, so one of the interesting things about Roche as a pharmaceutical company is it actually contains both a pharmaceutical division, so basically to make drugs for treating people who are ill, as well as a diagnostics division. So basically making diagnostics, be able to either identify someone's illness or understand that in more detail. And as such, it's always had a big emphasis around personalised healthcare. So this is the idea of being able to identify those treatments, really understand someone's disease and identify the optimal treatment for any one person's disease. Within that, there's sort of a recognition actually to drive those understandings about personalised healthcare, having data and advanced analytics to be able to interpret that data is going to be a real critical core component of that. And the idea being that by doing this can really help to understand the diseases and be able to treat people at a real level of unprecedented resolution. If we go to the next slide, one of the really sort of focus areas of Roche over the past few years has really been about integrating high quality longitudinal healthcare data together. Some examples of this is we've got a couple of partner companies, Flatiron, which is an electronic health records company, which provides real-world data on patients' treatments and outcomes in an oncology setting. And we have Foundation Medicine, which is one of the leading genomics profiling companies, again in oncology, which sort of enables people to get genomic profiles and use that information to be able to guide their treatments. And we've also been sort of taking a lot of care with our data internally, with around concepts of making it fair, definable, accessible, interoperable, reusable. So just making sure we're able to obtain the maximum value, the maximum information from the data we've got. Again, to be able to drive real deep understanding of each patient and their disease, and hopefully give them better treatments moving forwards. So, given sort of the backgrounds of the two organisations we've heard about here, about Turing and Roche, you obviously see there's a very natural overlap here. There's common goals, common aims and understandings. So it sort of seemed very natural we'd move into a partnership together. So we've sort of structured our partnership around our North Star, which is what's in the blue box here, to enable the generation of insights to better understand patient and disease heterogeneity, so really about concepts around personalised healthcare, and its relevance to clinical outcomes at an unprecedented level of precision in order to improve clinical care. So it's really this sort of the emphasis that it's about the outcome as well, that we're going to deliver patient benefit in the end from this work. And the way we sort of thought about structuring this work moving forwards is that we realised that's a huge task over on the left-hand side in order to do that. We're not going to get there in one go. But what we're aiming to do here was to identify areas of work, areas of research, either based upon some of the new technologies which are available, some of the scientific or medical questions which are available, some of the different data types which are becoming available, and sort of to treat those as individual little trunks which will able to put a foundation which will allow others, maybe ourselves, maybe other people, to build on in the future and take us towards our overall North Star of where we want to be. And as a way of working, we sort of have a number of principles of how we want the partnership to be working. We're very much committed, as the Turing is overall, to the concept of open science. So what we're looking for is the outcomes from this partnership to be things which are made publicly available, which really researchers anywhere can really take advantage of to move that forwards. We have a sort of a focus within the partnership around the methodology and the advanced analytics, but we realise this is built upon the data, and actually what makes this available really possible is just the wide diversity of data which is available nowadays. And these can be some of the data assets that we have internally within Roche. And I'll mention one of those a little bit later, but also some of the wider number of different data assets which are now publicly available externally as well. and maybe combinations of these we can make the most use of. Another principle of the partnership is all really about collaboration and working together. We're really wanting our research to have sort of active contributions from both parties, really sort of participating and bringing their own views on this and their own emphasis in order to drive this forwards. And also to really broadly bring the communities together, to bring the sort of expertise and the talent we've got across the different organisations, and really sort of see what synergies we can build between that. Prioritisation, we recognise that we're dealing with an area where there's just a huge number of different problems and a huge number of different questions we could be addressing. So we really sort of have to think about how we prioritise and what the areas we want to do with this, working in this area, and just think about how we can work in an agile way in order to achieve these. But whatever we're sort of involved in is we want to be driven by the North Star. We really want to sort of have this idea, is it going to be moving towards the driving forward the worst research? It's going to spin off further fundamental research, which in turn will have an impact on patients. So on this slide, just a little cartoon about sort of where the journey's gone so far between Roche Partnership, Turing and Roche. So it actually started several years ago, where we were one of the sponsors who brought a problem along to one of the Turing status study groups. And which was sort of the first time we sort of worked together and sort of gave people at Turing an opportunity to work with some of the data we have. From that spun out a number of interesting ideas, which we were keen to follow up on in a collaborative project, which took place over the summer and autumn later that year. And on the basis of that, seeing that these were, I think from both sides, this was something we could see working together, we sort of entered into a strategic partnership. Since then, we sort of identified 3 different research teams, which we'll discuss later in the partnership, as well as setting up a whole range of other activities, which help to sort of either build a community around the partnership, create something which is going to be a long-lasting legacy around that, and other things which can sort of just help us to drive the partnership forward and meet our research aims we're here. So one of the sort of the key pillars we have in this, which can really help us to drive this forward, is we've have now got 2 senior research associates, Rohan and Chris here, who have got roles which are partly to help us drive forward some of the research themes and some of the ideas within these research themes and help us to make progress in those. But also we've given them sort of time within their roles to actually spend half their time developing their own research areas, which are aligned to the research partnership, but really give us other dimensions we can be moving forwards in. So now I'd sort of like to hand over to them to just introduce themselves and give a little bit of background on themselves. So Rohan, do you want to tell us about yourself?
Thank you, Chris. Hi, I am Rohan. I'm a senior research associate with the Turing-Roche Strategic Partnership. Previously, I did my PhD in computer science in New Zealand, specializing in machine learning and computer vision. And then I was a postdoctoral researcher for around 3 years at Oxford University, focusing on biomedical image analysis in both radiology and pathology images for early disease diagnosis and robust prognosis. Recently, my work has been on transparent and robust AI in healthcare. Within the explainability work stream, I have been working on developing new models in graphical networks, presented on the left of the slide, where we try to place the nodes localized on areas of biomedical significance in digital pathology images at different scales. I have also been developing new attention-based deep models, where we ensure that the network focuses on clinically relevant features to take meaningful decisions. I have also proposed new formulations and some mathematical foundations in causal inference in machine learning, which is still a nascent area, but increasingly important area. We asked the question, the contrastive fairness question of why a particular decision was taken and not another alternative decision, which is sort of the next step from the counterfactual question of what if. I have also been working on continual learning models in the robustness workstream, where we try to ensure that the models can learn with new incoming data and while minimizing the susceptibility to concept drift and catastrophic forgetting and outliers. So this is more or less my area of research. I will hand over to Chris.
Hi everyone, my name's Chris, and I've been with the Turing-Roche Partnership as a Senior Postdoctoral Research Associate for not very long now, just only 3 months. It's been very exciting 3 months for me. And my road to the Turing has been a somewhat convoluted one, I suppose. Originally trained as a mathematician at Oxford, and then I did my PhD at UCL, which is in a mixture of different things, including some network theory, omics data analysis, largely transcriptomic, and also experimental biology, focusing on cell biological models of malignancy and also muscular dystrophy. After completing my PhD, I then trained as a clinician at Imperial, while at the same time doing a visiting postdoctoral scientist position at King's, which was largely focused on developing transcriptomic biomarkers, again with a little bit of network theoretic application. And after completing my medical degree at the start of this wonderful pandemic, I began working as a junior doctor at Guy's and St. Thomas's hospitals, and I completed my 2-year foundation training there before joining the Turing. So I'm really interested in all aspects of the Turing-Roche Partnership, from the model development from the mathematical side and statistical side, the computational analysis of the big data, to also the real clinical implications of the models that we're generating. And so though I've not been at the Turing very long, I've been exploring lots of different areas, in particular related to our main goals of predictive modeling and uncertainty quantification, and a bit of multimodal data integration as well. On the independent side of my work, I've developed a number of transcriptomic biomarkers for muscular dystrophy, which give you a more personalized predictive identification of how patients are going to progress for use in clinical trials, but also routine monitoring. Also been looking at stochastic gene expression models of the expression of certain proteins in single-cell RNA-seq data and other similar data sets. And this gives you an idea of how to target really heterogeneous proteins for developing therapeutics. And more recently, from the theoretical side of things, I've been exploring ways of understanding permissive biological network rewiring trajectories during certain biological processes, such as stem cell differentiation, oncogenesis, development of treatment resistance. And this has been a bit more mathematical, focusing on the use of discrete analogs of differential geometry measures to network theory. So really quite interested in all different aspects of the Turing-Roche Partnership, and would obviously be delighted to discuss any of these if anyone's interested, either via Slack or via email. And I think that's all from me.
Great. Okay, so no, thanks very much, Chris and Rohan. Yeah, and I'm sure we'll be hearing more from them in future knowledge share meetings, so I think they'll be quite regular participants here. So within, as sort of mentioned earlier, we've prioritised 3 major research themes within the partnership. So that's structured missingness, predictive modelling, and multimodality. And we'll just sort of go through each of these in turn and just sort of give a quick data update on where we are and sort of some of the activities within each of those at the moment. So starting with structured missingness. So this is an area which was really sort of recognised that as we were sort of putting together data from multiple different sources, it was almost inevitable we're going to end up with situations where we have this idea around structured missingness. So this isn't missing data, which is ubiquitous in almost all healthcare data, but is the idea that this would have some structure behind it. And either could we learn something from the structure, or are there clever ways of dealing with the situation when we can make use of having this structure compared to some of the methods which exist when you've just got random missing data. An example of sort of this motivation came from the clinical genomics database, which is kind of like the intersection of the 2 databases I mentioned earlier, the Flatiron, which had the clinical outcomes, and the Foundation Medicine, which gave the genomic analysis. So this is a very interesting data set that it provides across a whole range of different cancer indications, this combination of both really detailed molecular information and clinical outcomes from those patients. This then creates, but on the other hand, this does create a lot of interesting structure. So for example, it's going across indications. So we know that in different cancer indications, some different measurements are taken which aren't relevant in other ones. And we also know that from their foundation medicine that, again, depending upon the particular disease which is being looked at, say whether it's a solid tumour or a haematological tumour, you'll end up measuring different genes. So you imagine this will then give some structure within the overall data sets. So we've now set off 2 different projects which are going to be investigating different themes of these. And so I'd like to invite sort of the 2 project leads for these 2 themes to be able to just give an introduction to their talk. So, Robin.
Yeah, hi, thank you, Chris. Thank you very much, Chris, and hello, everyone. So my name's Robin. I'm an associate professor of statistics at UCL. And I'm also the Structured Missingness lead for the Turing-Roche Partnership. And so, as Chris said, I'm leading one of the funded projects in this part of the program. And in particular, it's on developing coherent Bayesian modeling and imputation to account for structured missingness. So obviously, Chris has already given a nice sort of background introduction to what we mean by structured missingness. And so one of the areas that we sort of realized is an issue here is imputation, because imputation is one of the most widely used approaches to deal with missing data, where you sort of fill in the missing values. But there's some types of structured missingness where that isn't really appropriate. So classic example in this sort of clinical type setting is when you might have, for example, a prostate specific antigen score that you'd like to record for patients, and for some patients it might be missing and could be imputed, but for example for female patients that isn't appropriate, right? There's a reason that those scores aren't recorded. Now obviously this is a relatively perhaps straightforward problem to address ad hoc, but we suspect in the very sort of complex sort of data sets such as the CGDB, there'll be some very complex structures of missingness there, and we want to be able to deal with that appropriately. And we think that in particular Bayesian modeling would be a very useful way to approach a problem where we can essentially model the bits of data, the parts of a missing data that we can't impute, and otherwise we can impute, and it can do it in a coherent way. And I should mention, of course, my wonderful team who will be working with us on this. So Professor Anna Basiri from Glasgow, and Rosie, Dr. Elena Rosalina from Erasmus MC Rotterdam. And we've recently appointed James Jackson as our PDRA to lead this work. We also want to look at ways to develop the existing packages that we all know and love for missing data, such as mice, for example. Many of you may have heard of that already, to see whether it can, firstly, is it already appropriate? We suspect it won't be able to handle all the complexities that structured missingness pose, but can they be adapted to, in appropriate ways to handle this problem? And interestingly, there's one other component of the problem, which is kind of flipping it around and seeing structured missingness as information itself. And so can we essentially utilize missing values as information itself, in particular structured missingness, which we think could contain some important information to leverage and help inform our imputations. So we've got various different facets to this problem of imputation here that we're going to be considering, but I'll finish there.
Welcome, everybody. I'm Ginestra Bianconi. I'm professor of applied mathematics at Queen Mary University of London, and of course, Alan Turing Fellow. And I'm leading a project aimed at characterizing the complexity of structural missingness. And our tool will be the tool of network science to and the goal is to quantify structural missingness in terms of networks and focus on the geometry of missingness. So the team is formed by myself and my co-PI, Ruben Sanchez Garcia from Southampton University, and our PDRA, Anthony Baptista. And we have really a complementary expertise respect to the team of Robin, because we are expert on characterizing and extracting information from networked interaction. So the project will be based into extract this structural missingness network from data. And in order to do that, we need first to characterize the pairwise, but also the higher order interaction. And then the network we will construct that will be very important to visualize structural missingness, but also to extract information from it, would be not only just formed by missing data and their pairwise interaction, but also by higher order interaction between more than 3 missing data. And sometimes we might want to use also tools to extract not only networks and hypergraph, but also network with triadic interaction or multi-layer networks, which have been successful tools to extract data from network topology. And the final goal is to, once this information has been extracted, is to provide a computational tool to improve machine learning, to inform and improve machine learning algorithm, and definitely to have a better understanding of patient and disease heterogeneity and better accuracy of treatment outcomes. And in all this, our research project, we will be always very open to interaction, in particular with the group of Robin, of course, and with the PDRA from the North Star Alliance, with whom we have already started to have a very fruitful interaction.
So, so we wanted to tell you a little bit more about some of the outputs that have come from our structured missingness work so far. So just to fill you in, we started the structured missingness theme with a series of workshops that we held in autumn 2021. So we had a series of workshops. Actually, Robin came on board a bit earlier than that. So we really kicked off the structured missingness theme through the summer and autumn of 2021. And we, like I said, we had a series of workshops on the topic, and then a series of subsequent discussions following on from those workshops. And out of those workshops, we produced an article that we wrote on the topic. It's a kind of perspective article on structured missingness as a field. And the article outlines current approaches to structured missingness, what people are already doing, and also proposes a series of grand challenges that collectively provide a roadmap for the development of structured missingness as a field of study in its own right, intimately connected to machine learning and necessary to advance machine learning at scale. So we wrote this article and it's going to come out very, very soon, this week actually, I think it is, in Nature Machine Intelligence. So my understanding is it's coming out on Wednesday. Is that right, Robin? Was it Wednesday?
That's what I've been told, yes.
Okay, so if you're a reader of Nature Machine Intelligence, please look out for the paper. It's due for publication soon. We think it's a significant paper because it really surveys the whole area and sets a roadmap for the future for understanding structured missingness. So that's really the first of our major academic outputs from the partnership, and it arose from the structured missingness work that we started in 2021. If we go on to the next slide, I can tell you a little bit more about what's in the paper. I'll only give a very high level summary. We outlined some grand challenges, so some of the big problems associated with structured missingness. Things like, for instance, simply defining or characterizing structured missingness. So we look into that problem. As Ginestra said, exploring the geometry of structured missingness and how you might use things like network science, for instance, to visualize it. issues of making predictions using data with structured missingness, similarly making inferences or estimations from data with structured missingness. How do patterns of structured missingness affect our understanding of causality? As Robin said, in many cases, imputation is appropriate, but in some cases it's not. So we also talk about that topic. We talk about incorporating an understanding of structured missingness into design of experiments for data capture. Also topics on benchmarking and evaluation of tools for handling structured missingness. And finally, underpinning everything, we discussed the ethical implications of structured missingness, how patterns of missingness might relate to key populations of interest, and how it might reflect underrepresentation of key populations in the data. So that's a very high-level summary of the paper. As I said, you can read it in Nature Machine Intelligence from this week onwards. So that was our first theme, structured missingness. We have now kicked off our second theme on predictive modeling. So we identified, as Chris said, 3 sub-themes that we were particularly interested in. The first sub-theme was to do with generalization of predictive models or predictions despite heterogeneity in the data. The second topic was prediction uncertainty in the context of personalized medicine. And the third topic that we were interested in was explainability and fairness of predictions in the context of AI for healthcare. So we were particularly interested in those 3 themes. We had another series of workshops at the Turing in autumn last year. So those were in person at the Turing, attended by about 40 attendees, where we explored all of those different sub-themes and discussed connections between them and synergies between them. So following on from that workshop, we issued a call for funded research projects in this area. And we've gone through the process of reviewing those submissions. We can't quite tell you about the projects that have been funded yet, but the outcomes of that funding call will be shared once contractual arrangements have been completed, hopefully very, very soon. So again, we're going to fund some more research projects in this area that will be kicking off very, very soon. And as with the structured missingness, we're also planning to write some papers on the topic, and we have 2 that we're considering and working on at the moment. The first one is in robustness in healthcare predictive models, and the second is on the concept of patient-centric fairness. So we're working on those now, and hopefully we'll be able to update you on those papers at some point in the future. And then the next one, so this is our final or our third theme that we are going to be focusing on in the partnership. So we had structured missingness 2021 onwards, predictive modeling from 2022 onwards, and through 2023 we'll be working up this third theme that we're particularly interested in, which is multimodal data integration and analysis. This of course is at the early stages now, we're just planning it, but our initial focus will likely be on combining genomics and imaging data for oncology, for understanding oncology. So we're in discussion on the best ways to approach these kind of questions and how to address this topic. Those discussions are underway. If you had any thoughts on that, we'd love to hear from you. But you can expect to see some activity from us in this area through 2023, and we'll obviously promote it to you all, and Vicky will promote it, and we'd love for you to be involved in those activities if you're interested. And now I think I'll pass over to Vicky.
Yeah, that was a good segue. Yeah, so I will just finish up very quickly on the community aspects of the partnership as my role as community manager. So when we were planning the partnership, we felt this was really key to have this kind of joint community between Turing and Roche, which didn't exist. As Chris mentioned, we'd only kind of previously worked together on a small project, and we felt this was kind of key for long-term success and sustainability of the partnership. So the initial kind of considerations were around kind of mapping out connections between Turing and Roche, taking into account kind of different ways of working between academia and industry and different ways of engaging, and also how we wanted to involve you guys, the wider scientific community, into the partnership as well. So probably stating the obvious, but our first kind of approach is putting the basics in place. So creating a space where Turing, Roche and the wider community could connect with each other easily. We felt this was really important to have a kind of low barrier to entry. So Slack really suited our needs for that. So we set up that Slack workspace in 2021. And then we set about raising awareness of the partnership on both sides through existing networks. So leveraging what was already in place in Turing. And in Roche particular, they had a relatively kind of new advanced analytics network, which was very good to connect with. And we also looked at where we could kind of get quick wins. So inviting Roche colleagues to initial kind of workshops we were running to facilitate those kind of organic interactions, highlighting opportunities at the Turing that were already available for Roche to get involved in. So things like the Turing interest groups. And yeah, so obviously the next stage was kind of developing that. So these are current ongoing activities. The Slack workspace, as I mentioned before, which has kind of specific channels for events, papers, jobs, always keen for anyone to start conversations. So we're now up to about 500 members in there, which is really great to see. And we have a monthly newsletter, which features partnership updates and news, events and opportunities from both Turing and Roche. And we're always happy for you to contact us if you want anything featured. We also established this board of partnership advisors. So 5 academics and 5 people from the Roche side who help advise us on those research themes, and also have recently been collaborating with our postdocs. We set up a GitHub repository, which stores documentation from the partnership, which is part of our kind of open science and transparency pledge. And then we started this knowledge share series in April last year. As I mentioned, this one's a little different to our normal format. So we usually have one speaker from Turing and one speaker from Roche discussing their perspective or their work on a data science topic. And we hope you're enjoying them. We'll be continuing those this year. And we've also been hosting the recordings from those on a YouTube channel. And we've also been looking at developing more kind of video content. So we started a kind of demystifying video series, and we'll be exploring that a bit more this year as well. And then other community activities include the kind of workshops that Ben just mentioned. So it's been really good to interact with the community at these. And then lastly, our plans for 2023. We're hoping to launch an early career researcher ambassador scheme this year. And the dates are still TBC on that, but we're hoping that this will allow PhD students to work on community-based aspects of the partnership and represent us at a conference. And we're also looking at what events to run this year to start seeding ideas again on both sides. And also we want to continue facilitating connections outside of the formal partnership funded projects as well. So collaborations that might not require kind of huge funding or access to data. So one of those I'm keen for is getting Roche colleagues to contribute to the Turing Way, which is a collaborative guide on data science and reproducibility. And lastly, any ideas you guys have, please get in touch. We'd love to hear kind of what you think would work well. We do have quite a lot of kind of flexibility in what we can organise. So I will now go back to my host role. That's it from us. Sorry, we overrun a bit, but we've got about 12 minutes for any questions. So I will repost the Slido link in the chat. And I will post some of those questions now. So we actually have 2 individual questions for Ginestra and Robin. So Ginestra, one for you. With higher order interactions, how high an order of interaction do you think you will be able to identify?
Yes, so thank you so much for this question. Yes, so there is a kind of numerical obstacle in considering arbitrary big higher order interaction. Of course, this is also calculating the number of clicks in a network is an NPR problem. So there are different ways to deal with that. So one way is to construct higher order networks based on pairwise interaction, for instance, and this is a shortcut, but still one will be able to recover the geometry of structural missingness. And another shortcut is to focus on part, so relevant part of the data set or relevant type of interaction one wants to detect. So yes, running higher order interaction in the full clinical genomic data set is probably behind any capability, but we have a strategic way to tackle this question.
Sorry, I was muted. Thank you, Ginestra. And Robin, your question. With your Bayesian modeling, do you envisage using non-informative priors or informative priors? And if so, how will you elicit these in this setting?
Yeah, it's a great question. So the standard sort of way you would normally deal with imputation, Bayesian imputation sort of models is you would use non-informative priors because I mean, you don't really want, you just want to let the data do the talking, I suppose. I suppose the only reason you might be is if you had real subjective information about something to do with the missing values. And this kind of leads into structured missingness because structured missingness has some obviously underlying sort of structure there, some associations. And so there may be value from both coherent sort of Bayesian perspective to put in some information into your priors, but also to facilitate model fitting, because the structural nature of a missingness might make fitting models with non-informative priors quite challenging, if not infeasible sometimes, because you might sort of, for example, have parameters that aren't identified without sort of some kind of subjective prior information to help underpin the models. We are actually also actively thinking about the informative prior area with respect to including information, as in if a structured missingness has information to sort of leverage, as it were, to sort of build some informative models, then one convenient way that can be done is through a Bayesian framework and through using that information in a subjective prior. So the informative priors is certainly a component we will be exploring, which isn't something that, at least in most missing data problems, is done. So it's certainly something that here we think could be very relevant.
Thanks, Robin. And the next question, I think, probably for Chris and Ben. So what is your vision for the outcome of the research projects from this partnership to be? Is that kind of publications or applications in the real world?
Oh, yes. Yeah, both of those. Yeah. I mean, we want to advance the state of the art. So we want to advance our knowledge in these areas. And we want that knowledge to be freely available. So if that means published papers, that's what we want to do. If it means new computational packages, that's what we want to do. So whatever is the right route for advancing that and advancing us towards our North Star.
I think Ben
that's what we want to do. Dry academic ideas. Oh, am I breaking up?
Only just slightly, you're back.
Oh, sorry. I'll be quick then. We don't just want dry academic ideas. We want to see these things put into practice.
Chris, did you want to add anything on that? Yeah. No, I mean, I think Ben covered it. And I think probably, if you sort of say take the end result being a clinical decision tool for a specific disease, Alzheimer's, for example, then it's unlikely probably we're going to generate that specific tool within the context of this partnership. What we're really hoping to do is having those building blocks in place. So we're asking some of the methodological questions about the topics and themes we're talking about, which will enable someone else in the future with appropriate data sources to be able to answer those. So as Ben says, it's very much with that sort of end goal of the clinical impact in mind in all the times. But yeah, we probably do have more of a focus on the more fundamental research within that.
Great, thank you. And again, I think probably for you too, but could you talk a bit about the avenues of research collaboration for those affiliated with neither Turing nor Roche? I will just get started by saying the funding calls we've run were outside. You don't need to have a formal affiliation with either. I would also signal working with our postdocs, Rohan and Chris, but Chris, Ben, I don't know if you want to add a bit to that.
Well, I mean, only to reinforce that, yeah, all of our community activities are open. So you're welcome to all of the activities that we do, all of the workshops, you know, partnerships, whatever. It's all open to everyone.
Yeah.
Yeah, and that's it. And yeah, if you want to, everyone wants to reach out to Chris and Robin and Ginestra and Rohan, feel free to do so.
Great. Is there a roadmap of other research topics you hope to cover in the coming years, and who decides on these? Again, I think for Chris and Ben.
Yeah. So I think the three topics that the themes that we sort of described today are going to be the ones we're focusing on within this partnership, which is kind of like a 5-year partnership. So I think it's going to be activities around there. And I think this is jointly sort of decided in the partnership of what we're sort of seeing as the key areas of interest, the key opportunities, the sort of the big gaps and what's available at the moment. From the experiences we've had and the conversations we have with different people.
Yeah, particularly with our advisors who you mentioned, Vicky.
Yeah, they've been really key for kind of helping us know a bit more about what's hot in the field, I would say as well. The next question is, what is the appetite, presumably from Roche, for including data collection activities as part of the future studies?
I don't think we probably see that as a priority of this partnership. I think this partnership, I think we're sort of playing around sort of being a partnership around the advanced analytics. Roche is involved and does have connections both with some of the other data collection activities going on. So for example, our Future Health, which is starting, Roche is one of the partners there, Genomics England, their UK Biobank, we've got connections there. So I think it's sort of through those aspects, those sorts of collaborations is probably where we're going to focus on the data collection aspects of things. Here, I think we really want to think about what we do once we've got the data and how we can use that to make patient benefits.
Thank you. Also, have you considered additional therapeutic areas for predictive modeling, e.g. ophthalmology and hepatology, or image biomarker-rich data sets? I don't know how much you want to say on predictive modeling, because I know we can't do a kind of announcement yet, but I don't know if you want to give the general idea or whether we've kind of considered that area.
Well, I mean, we would have been receptive to it, I guess, if someone had presented those ideas in a funding proposal as part of our recent call. We've gone through the review process and we can't quite announce it yet, but we will be doing that soon. But yeah, certainly we wouldn't exclude it.
I think we're sort of thinking about that in quite a therapeutic or indication agnostic way. So hopefully if you get something which deals with how to deal with uncertainty in predictive models, that can be applied to a model built in any particular disease area. And that's what we're interested in here.
Great. I'm just going to try and squeeze the last one in as well. So would there be any projects on PETs in healthcare which may be taken up? I'm not sure what that stands for, sorry. You're not sure either?
I'm not sure, and also you broke up for me, sorry.
Oh, sorry.
PET would be privacy enhancing technology.
Yes.
Yeah.
Oh, Rohan, why don't you can take that question. You've been considering that.
Well, it depends on whether we have strategic scope of including that, but I guess privacy enhancing technology in the context of transparency of AI in healthcare is sort of already in our scope in predictive modeling. So in that sense, it can be a topic, but I'm not sure whether we have thought of PET as a separate focus area.
Great, thank you, Rohan. We've just got a minute left, so I'll stop there on the questions. But